So, you're ready to schedule your first mammogram. Are you nervous? Do you have questions? We made this short video to hopefully answer questions and lessen your anxiety. So let's start with the basics. What is a mammogram? A mammogram is an X-ray image of your breast. So it uses the same sort of X-rays that you might use to find a broken bone or to look for cavities at the dentist, but this machine is specifically made to look at the soft tissues of the breast, and it uses lower radiation. So the mammogram, like any X-ray picture that we take, we like to get two views. The two views we get for the breast are, first, an oblique view. The oblique view is kind of side to side at an angle, and this includes your armpit area, or the axillary tissue as we call it. You might wonder why we include that tissue. There's a couple of different reasons. The first reason, in many women, your breast tissue actually goes up into your armpit area. The other reason is to look at those lymph nodes that are in that area. So that's the first view. The other view is from top to bottom. We call it a craniocaudate or a CC view, and that is when the breast is compressed from top to bottom. So those are the two basic views. At our facilities, at our 6 offices of diagnostic imaging centers, we actually use digital mammography. Now, what's digital mammography mean, and why is that important for you? Digital means the detector is actually a digital detector instead of a film screen cassette. So, traditionally, a film screen cassette would be exposed. That film screen cassette would have to be taken from the room and then developed through a processor, taking several minutes. With a digital detector, the X-rays expose the detector, and the detector is connected directly to a computer. So within seconds of the image being exposed, those images pop up on the screen for the technologist to review. So for you, it means shorter time. For the radiologist interpreting your images, it means that those images are reviewed on a big computer screen, and those images can be manipulated. Several studies have shown that there's improved sensitivity, so a more accurate interpretation of mammograms in certain groups of women. Who are those groups? Mainly they're women who are younger, women with dense breasts, and no, you can have dense breast tissue at any age. And the other population that again is going to have a better view with a digital mammogram is going to be women with implants. So those populations, really important to make sure your facility is using digital mammography. So what will happen when you come for your mammogram? You'll come in, and the first thing we're going to have you do is fill out a history sheet. This is important information for the radiologist, so the radiologist will know your specific risk factors for breast cancer. Now, we follow the American Cancer Society guidelines as well as the American College of Radiology in saying that you should start your mammograms at the age of 40 and have those mammograms every year. We'll ask you about your family history because that is an important factor in determining your specific risk factor for breast cancer. But remember, only a small percentage of breast cancers in this country actually have a family component. It's only about 15% of breast cancers. So let me put that another way. 85% of breast cancers we find in this country are in women who have no family history. So if you don't have a family history, don't think you don't have to come in for your mammogram. Come in. If you have breasts, if you're female, you are at risk. You need to come in for your mammogram. So after we fill out the history sheet, we'll ask you about your hormone usage. We'll also ask you about any surgeries to your breast. The technologist will take you to a dressing room. You'll change you into a gown. After you've changed, the technologist will take you into the room. And the first thing she's going to ask is whether you have on deodorant. You might wonder, why does it matter? Why am I asked not to put on deodorant the day of my exam? The reason is most deodorants contain metal. They have aluminum salicylate or one of those sorts of compounds in them that have little tiny pieces of metal. And that can actually show up on the mammogram and look like one of the changes we look for in early breast cancer, little tiny calcifications. So if you've used deodorant, we'll ask you to wipe the deodorant off, then we'll proceed with the mammogram. The technologist will position you for the view. And the first thing she's going to do is pull your breast tissue forward so that it's on the detector. And it might feel like she's trying to pull your breast off, but she really isn't. The thing she's trying to do is get all of your breast tissue on the detector. Remember, if your breast tissue is not on the detector, it will not show up on the mammogram. After your breast tissue is pulled forward, a plastic compression paddle is going to come across and apply compression to your breast. This is the part that's uncomfortable, but the thing to remember, is first, it only lasts for seconds. The compression lasts for about 10 seconds as the exposure is being made. As soon as the exposure is done, there will be a beep and the compression paddle will automatically release. So it's a matter of seconds for each view of your breast. The other thing that might help you is to know, why are we using compression? What's the reason behind it? It's a very important part of getting a good mammogram. It does three things. First, it evens the breast tissue out. And again, we're taking an object that isn't flat and making it flat so that we can expose the tissue through it. And in order for that exposure to be appropriate, all the tissue has to be about the same thickness. So that's step one. Step two, it keeps the tissue from moving. Any motion on the picture is going to really limit our ability to find some of those early signs of breast cancer. So again, holds the breast still, keeping it from having motion. The other thing the technologist may do is have you hold your breath. And again, that's why she's having you do that, so we don't have motion. The third reason we use compression, and probably the most significant, is it helps us find early breast cancers by pushing away normal tissue. If you look at a mammogram, your glandular tissue, or the tissue that makes up your breast, is white. What do some cancers look like? They look like white masses. So on the background of this white, the way we find them is by pressing that normal breast tissue out, which will disperse away, whereas breast cancers are hard. They have tissue around them that's a little bit scarred. They will not press away. They will highlight for us breast cancers by using compression. So a very important part of getting a good mammogram. So once the compression's applied, the technologist will expose the image. This takes a matter of seconds. As soon as the exposure is done, the paddle will release. The technologist will reposition you for the next view. She'll check the images as they come up on the computer screen for technique. Once the 4 views are obtained, she'll take you back to your dressing room. Now at our facility, here's where it's a little bit different. In most facilities, you would then go home and you would wait for your results to come to you in the mail in about 5 to 7 days, depending on the facility. At our offices, the radiologist is there while your procedure is being done, and the radiologist is actually going to interpret your images while you are there. So we'll ask that you stay in your dressing gown when you're in your dressing room. The technologist will take your paperwork, and the images will go directly to the radiologist on the big computer screen. They'll do a couple things. The first thing we do is make sure we have a technically good exam. So there may be motion, there may be folds sometimes that hides tissue. Sometimes we're not including all the tissue we want to see. So if that's the case, we would ask the technologist to go back and repeat one of those views. If your mammogram looks good, the next step, again, after we've looked at the technical factors, is to try and find those signs of breast cancer. We'll interpret the images while you're there. If your images are normal and we don't see any signs that are worrisome, you'll get that piece of paper that says everything looks great. You can go on your way. You're done. You know your results. You're all through with your first mammogram. Now, what happens, say, if we see a sign on there that we're concerned about that needs further evaluation? What would happen then? What we do next is we ask for a diagnostic mammogram. That's different than your screening mammogram. It's a workup of something I see, or maybe it's a workup of a symptom. If you have a breast mass or a lump or some pain, that's all considered a diagnostic mammogram. At our facilities, you can have that diagnostic mammogram done that very same day. So following your screening test, the technologist will come back to the room and say, there's something we want to get further evaluated. We're going to do some extra views. And we would, in general, do those extra views right there that very same day. Occasionally, that might be followed by another imaging technique, a breast ultrasound perhaps. And again, we can do that very same day. And again, at the end of the evaluation process, after the radiologist has interpreted those extra views, we will go out with a results sheet telling you exactly what the finding was and what the final interpretation of your mammogram is. So, are you ready to schedule your mammogram? You can call our scheduling number and make an appointment at any of our 6 offices. We have appointments from 8 in the morning until generally about 6 at night, and we also do have some appointments available on Saturday morning. When you schedule, it's important, if you're still having your menstrual periods, that you try and schedule it in the first part of your cycle. Your breasts are going to be less tender then. So whenever your breasts are less tender, that's when you want to come in for your mammogram. If you're worried about that compression, kind of concerned that it might be painful, it's okay to take some ibuprofen or Tylenol, although I can tell you, you usually don't have to do that. It's okay. Schedule it with a friend. Come in with a friend. That's all right. We encourage you to do that if that makes you more comfortable. And it's okay to call your friends and say, hey, have you scheduled your screening mammogram yet? We hope this has answered your questions. We hope you come on in. We'll take good care of you.